Hello everyone, welcome to Rbiochem.matrix. Today we are going to discuss about the bacterial diseases. Right now, millions of microscopic single-celled organisms are living on your skin, inside your gut, and on every surface you touch. Most keep you alive, but a selectively few have the power to take down entire civilization. Today, we are looking at the most dangerous bacterial diseases known to science. Some common bacterial diseases are tetanus, cholera, black plague, dysentery, diarrhea, typhoid, etc. Tetanus is a serious bacterial infection that affects the nervous system and causes painful muscle stiffness and spasms. It is caused by the bacteria Clostridium tetani, a gram-positive anaerobic spore-forming bacillus-shaped bacteria. Mode of transmission: it enters the body through cuts, wounds, punctures, burns, or breaks in the skin. Contamination with soil, dust, manure, or saliva. More risk in unclean deliveries, especially umbilical cord care in newborn. Pathophysiology: spores enter the body through wound. In anaerobic conditions, spores germinate and multiply. Toxin produced travel to the nervous system. It blocks inhibitory neurotransmitters GABA, glycine, causing continuous muscle contraction and spasm. Clinical features: muscle stiffness, especially in the jaw. It is also known as the lockjaw disease, difficulty in swallowing, muscle pain, spasm. Year of identification: tetanus was identified in 1884 by German physician Edward Nicolaier. Diagnosis: there is no specific lab test for routine diagnosis. Lab test: wound culture may show Clostridium tetani, but not always. Treatment: wound cleaning and debridement, removal of dead tissues, tetanus immunoglobulin to neutralize the toxin, antibiotics such as penicillin to kill the bacteria, and supportive care. Vaccination is the best prevention. TT vaccine is safe and effective. Tetanus toxoid, part of routine immunization. Precautions: get vaccinated, booster dose every 10 years. Cholera. Cholera is an acute intestinal infection caused by Vibrio cholerae bacteria. It leads to severe watery diarrhea and dehydration, which can be fatal if not treated promptly. The causative agent is the Vibrio cholerae, a comma-shaped gram-negative bacterium. It lives in contaminated water and attaches to the small intestine, releasing a toxin that causes severe watery diarrhea. Mode of transmission: cholera spreads mainly through the fecal oral route. Contaminated water, food, unclean hands, and infection. Causes: drinking or using contaminated water, eating food contaminated by infected person's feces, poor sanitation and inadequate sewage disposal, poor proper hygiene. Year of identification: in 1854. Cholera was first identified during first global pandemic in 1854 by Dr. John Snow. Symptoms: sudden onset of profuse watery diarrhea, vomiting, severe dehydration, thirst, dry mouth, muscle cramps, low blood pressure, rapid heartbeat, etc. Diagnosis: stool examination, culture, rapid diagnostic test, laboratory confirmation. Treatment: immediate rehydration is the mainstay. Oral rehydration solution for mild to moderate dehydration, IV fluids for severe dehydration, antibiotics to reduce severity and duration. Precautions: drink safe water, wash hands with soap, eat well cooked food, wash fruits and vegetables with the safe water, use hygienic toilets, avoid open defecation. Black plague. Black plague was first identified in the year 1894 by Dr. Alexander Yersin. It is caused by the bacteria Yersinia pestis. The mode of transmission: flea from infected rodent bites human, human to human, and handling infected tissues to the healthy person. Diagnosis: blood culture, dark field microscopy, rapid diagnostic test, dipstick, and the treatment bubo aspiration, giving antibiotics and supportive care. Precautions: rodent control, trap sealing gaps and more food, flea control, avoid contact, isolation, protective gear, hygiene, and education. Symptoms: buboes, fever and chills, cough with bleed, blackened skin. Dysentery. The dysentery was first identified in the year 1898 for bacterial dysentery, and for the amoebic dysentery it was identified in the year 1875. The primary pathogens: bacterial dysentery is caused by the bacteria Shigella dysenteriae. Amoebic dysentery is caused by the Entamoeba histolytica. The vector is the common house fly. Mode of transmission: poor hand hygiene, contaminated hands, flies on foot, and ingestion. Diagnosis: stool microscopy, colonoscopy, stool culture, and PCR. Treatment: rehydration, antibiotics, antiprotozoals, and supportive care. Precautions and prevention: hand hygiene, safe drinking water, proper food preparation and cooking, sanitation, and waste disposal. Diarrhea. Diarrhea is the passage of loose, watery stools 3 or more times a day. It can lead to dehydration and loss of nutrients. Year of identification: it was first identified in 1885 by Theodor Ehrlich. Vector: diarrhea is usually caused by infection with virus, bacteria, or parasites. Common pathogens: rotavirus, E. coli, Vibrio cholerae, Salmonella, etc. Mode of transmission: contaminated water, contaminated food, dirty hands, which leads to infection. Spread mainly through the fecal oral route. Flies can also carry germs from feces to food. Diagnosis: stool examination, stool culture, rapid diagnostic test, blood test, clinical evaluation, and history. Treatment: oral rehydration solution, zinc supplements, continue feeding, adequate fluids, antibiotics only if bacterial infection is confirmed. Severe dehydration may need IV fluids in hospitals. Precautions: wash hands with soap before eating and after using the toilet. Drink safe boiled or purified water. Eat fresh, well cooked and covered food. Wash fruits and vegetables thoroughly. Use clean toilets and maintain sanitation. Typhoid. Typhoid fever is a bacterial infection caused by Salmonella typhi that affects the intestine and spreads through contaminated food and water. It can cause prolonged fever and serious complication if not treated. Typhoid is caused by the bacterium Salmonella typhi, which is a gram-negative bacillus-shaped bacteria found in intestine and gallbladder of infected person. Lives only in human being. Carriers can spread the infection without showing symptoms. Mode of transmission: typhoid spreads mainly through the fecal oral route, contaminated water and food, infected hands, ingestion, and infection. Healthy carriers can also spread the infection. Year of identification: Salmonella typhi, the cause of typhoid fever, was identified in 1880 by Karl Joseph, a German physician. Diagnosis: blood culture, vital test, stool culture, bone marrow culture, clinical evaluation and history. Symptoms: prolonged fever, headache, weakness, loss of appetite, abdominal pain, constipation or diarrhea. Treatment: antibiotics, oral rehydration solution, paracetamol for fever, adequate rest and nutritious diet. Complete the full course of antibiotics as prescribed by the doctor. Prevention: wash hands with soap, drink safe water, eat freshly cooked, hot and hygienic food, wash fruits and vegetables thoroughly, use clean toilets and maintain sanitation, dispose of waste properly. Tuberculosis. The causative organism for tuberculosis is the Mycobacterium tuberculosis, slow growing and acid fast bacterium. Causes and transmission: infected person, aerosol transmission, coughing or sneezing, infectious emission, infectious droplets. Spreads through air from person with active pulmonary tuberculosis. Diagnosis: chest X-ray, sputum smear, culture, rapid molecular test. Treatment: combination of antibiotics, directly observed therapy recommended, first line drugs, long duration 6 months. Prevention: BCG vaccination, infection control, masks, ventilation, treating latent tuberculosis infection, public health education. Pneumonia. Year of identification 460 to 370 BC. It was first identified by Hippocrates. Pneumonia is caused by bacteria such as Streptococcus pneumonia and Haemophilus influenzae, and virus influenza, and also by some fungus. Diagnosis: physical examination and chest X-ray and lab test. Mode of transmission: airborne droplets from the infected person to the susceptible person. Precaution and prevention: PCV flu vaccination, hand hygiene, respiratory etiquette, avoid smoking and healthy lifestyle. Treatment: medications, oxygen therapy plus supportive care. Pneumonia commonly affects the alveoli. A comparative difference between common cold and pneumonia. Common cold does not affect the alveoli, it is an upper respiratory infection, whereas pneumonia affects the alveoli, it is the lower respiratory infection. Thank you for watching this video. Do post your doubts in the comment section. Thank you.